Have you ever found a tiny lump on your dog or cat and thought, "It's small, maybe we can just watch it"? Sometimes that's true, but if that lump is on the ear, the toe, or the tail, waiting can turn a small problem into a much bigger surgery. Today, I'll explain why location matters more than size when it comes to skin tumors in pets. When people find a lump on their pet, the first thing they look at is the size. But in veterinary surgery, location can be just as important as size. The ears, toes, and tail all have one thing in common. They have very little extra tissue. So when a tumor grows in these areas, there is not much normal skin around it that we can safely remove. If the mass becomes too large, removing just the lump may no longer be possible. Sometimes we have to remove the entire structure. Let's start with the toes. Tumors around the toe or toenail can be more serious than they first appear. In dogs and cats, tumors in this area can include melanoma and squamous cell carcinoma. Because the toe is such a small structure, once the tumor grows beyond a certain size, the safest treatment is often removing the entire toe. If the lump had been removed when it was small, a simple surgery and biopsy might have been enough. But when the tumor grows larger, the surgery can become much more extensive. Next, the ears. This is especially important in cats. Cats can develop squamous cell carcinoma on the tips of their ears. Early on, these lesions may look like a small scab, a wound that does not heal, or a tiny bump. Because they look minor, they are sometimes ignored. But if the tumor continues to grow, treatment may require removing part of the ear flap. This surgery is called a penectomy. When detected early, however, a much smaller surgery may be possible. Now let's talk about the tail. The tail also has very limited skin and tissue. If a tumor develops there and continues to grow, we may not be able to remove the mass with safe surgical margins. In some cases, the best treatment becomes partial tail amputation. This is why early removal can make a big difference. Many pet owners ask the same question: what if the lump is benign? That is a very reasonable concern. The problem is that many skin tumors look very similar on the surface. Even veterinarians often cannot determine whether a lump is benign or malignant just by looking at it. The only way to know for sure is through cytology or biopsy, and in areas like the ears, toes, and tail, waiting for the mass to grow can make treatment much more difficult later. So when should you see a veterinarian? You should have a lump checked sooner if it is growing quickly, bleeding, not healing, or if your pet keeps licking or chewing the area. A swollen toe or a wound on the ear that does not heal should also be examined. When in doubt, it is always safer to check early. So remember this: a tiny lump may not always be an emergency, but when it appears on the ears, toes, or tail, it is usually better not to wait too long, because sometimes small today means a much bigger surgery tomorrow.